Hi, this is Cody with the Obstacle Doc. We're going to take a look at a seated good morning exercise. We use this exercise a lot in a way to promote lumbar extension of our spine, mobility of our hips. So when we have people coming in complaining of low back pain with activities like squats or deadlifts, or they have a difficult time with sitting or standing for long periods of time, this is a really nice way for us to kind of open some things up and prime some muscle groups for some of these bigger tasks that you might see in the gym. So Daniela here is going to sit with her feet a little bit wider than shoulder width apart. She's going to, before she starts the hinge movement, she's going to think about driving her belly button forward, sitting up as tall as she can. And from here, she's going to maintain this nice straight spine and take everything forward in a hinge position. She's doing a great job here of demonstrating this tall spine throughout the movement. And if you do a good job of maintaining this, you should feel some load, some challenge through your spinal extensor column. And you'll also feel some stretch strain through your hips, your hamstrings, maybe depending on how you position your legs. It's a great way to work on that mobility. Say this is difficult. A way to regress this would be to widen the feet just a little bit more. So now Daniela's got her hips, her knees wider than her shoulders. This will open the hips up, allowing for a little bit more freedom around the low back. A way to progress this then, you could place weight in hands, hold some weight at your chest, or rest a barbell on your back and continue to progress the same movement as before. So the biggest error that we might see in this movement is as we try to hinge forward, we're going to see a rounding of our spine. And that can happen in the thoracic spine region first if people are just thinking about this as a seated toe touch, or if we're just lacking capacity of our extensors, we might see the low back start to round and come out the other way instead of what we should see here, which is this nice strong extension. In terms of dosage, I like to have people perform about 5 or 6 repetitions of 5 to 10 second holds. It's a nice way to get to the end of the movement, challenge an area that we don't often think to challenge ourselves in, and work on that capacity in the end of our range there.